Hi there, LWT240 students. Today I'm just going to do a short video that focuses mainly just on Chapter 19 in your textbook. So Chapter 19, you will see, deals with overweight and obese populations along with metabolic concerns, okay? So really in your textbook, chapters 18 through 23 deal mainly with special populations and how to design a program centered around that special population. So you'll find a lot of great information on different health conditions and then some strict recommendations as far as, mode, frequency, intensity, type, and then also with some special concerns and things you should maybe avoid for that particular population. So that those group of chapters in your book are just designated towards all these special populations. So today I'm going to look just at chapter 19. But before I do, I just wanted to stress that it is unrealistic to memorize the recommendations for each disease condition. So there are so many different disease conditions that we're going to go through over these next few chapters that it's hard. But we could recognize the similarity in the recommendations. So you'll see a slide here at the end today that goes through just a similarity of these different conditions when it's regarding metabolic disease and obesity. So that's the thing we want to strive for, is just recognizing the similarity in a lot of these special populations in the programming. We also have to recognize that a majority of these clients are going to be novice, meaning they're beginners. I mean, we have to start off with the very basic of the basic movements. And I've said this to you all before. We don't want to start off with burpees, for many of our clients. That's something that we may never do with some clients. And if so, it's going to be a long progression to even get there. Also, make sure you're following the precautions and the contraindications. Again, when you look closely at each one of these special populations, you're going to see in your textbook, it talks about precautions and contraindications, things that you should not do with your special population. So pay attention to that stuff, because we don't want to be held liable having them do something that isn't recommended. The foundation of any exercise program is progression, and we've talked about this. It's important to start off very basic with these novice participants and slowly progress as we work through the weeks. And also, underlying cardiovascular disease is the cause for concern and health care referral. So if we find that they have signs or symptoms of cardiovascular disease, it is concerning. There could be something wrong, and we definitely want to refer them to their healthcare providers. So when in doubt, refer it out. Remember that? So let's look at just chapter 19, which deals with metabolic considerations. Okay, that population, metabolism. Something's wrong with it's an altered metabolism. So here you can see some of the ones that are talked about in this particular chapter. One is overweight or obese clients. 2 is those diabetics, type 1 and type 2. 3 is the hyperlipidemia, so cholesterol folks. And then 4 is that metabolic syndrome category. So those are the 4 metabolic conditions that are discussed in this chapter. So first of all, looking at overweight and obesity, we know that it is the second leading cause of preventable death in the U.S. Keyword, preventable death. So definitely by changing lifestyle habits, these folks can prevent the onset of death due to this concern. Also, they have an increased risk for heart disease and an increased type 2 diabetes in children and adolescents. So those children and adolescents that are overweight or obese, they have a huge risk of developing type 2 diabetes. Those adults that are overweight or obese, they have an increased risk for developing heart disease. Okay, and how do we define overweight or obesity? When we look at our BMI. So you know that obese is 30 and above, right? Overweight is 25 to 29.9. Also, if you couple that with a high waist ratio or high waist circumference, definitely they have a very high disease risk. When you couple that with, someone who's obese, for example, and then they have a high above 40 for men and above 35 inches for women, waist circumference, their risk for disease is also very high. Okay, so when we couple those things together, disease risk is pretty prominent. Here you can also see the relationship between resting metabolism. So this blue line shows us the resting metabolism, and the green line shows us their energy intake. So you can see, obviously, people who are obese, their calorie intake is high, right? Somebody who is not eating a lot of calories in a day is generally not going to be overweight or obese. It's about calories in and calories out. So we tend to see obese individuals with a very high caloric intake, but you can see there's an inverse relationship. Their resting metabolism goes down. Okay, so even though they're ingesting all these calories, they're still in a positive energy balance because their body is not burning off those excess calories. But you can see people who are of an ideal weight, they balance those out. So they're ingesting the recommended amount of calories in a day, but their metabolism is burning those calories off. Okay, so they cross each other and they're in a caloric balance. Okay, so we see that with a lot of our obese and overweight clients. So what are some things that contribute to overweight and obesity? Well, there are many. You could take a minute and jot down some examples for each one, but real quick, if you look genetic, people are just predisposed and born with an altered metabolism. It's a chronic disease that has slowed down their metabolism, or a disease that they were born with that has an effect on their metabolism, and it slows it down, and that causes them to be overweight. Maybe it's a metabolic or physiological problem. So maybe they have lower muscle mass, and that's contributing to an altered metabolism, and therefore they're not burning off as many calories. Maybe it's behavioral. It's a behavioral thing, right? The choices, the things that they're doing on a day-to-day basis, they're not exercising. So that's, leading them to burn fewer calories every day. Maybe it's environmental, the environment that they're in. Maybe they don't have access to, a facility to exercise, or maybe they, in that environment, it just is not conducive to healthy eating or exercise. Cultural, maybe it's part of their culture. What do they, I know, for example, when I think about my husband's family, they're Hispanic, and when we get together, there's a huge spread put on, and a lot of that Hispanic food that's being cooked is definitely not healthy, but that's part of their culture. Socioeconomic, having access to healthy, nutritionist foods. A lot of people don't have to purchase healthy, nutritionist foods. So there are many more examples than that under each category, but note that as a personal trainer, we can help influence those factors. We can help our clients to make changes so they don't have those in the way. Okay. So TLC, the therapeutic lifestyle change. This is recommended for people who have metabolic disorders. It's considered that first line of therapy. So the TLC is number 1, diet, number 2, exercise, and number 3, weight loss. So most obese individuals definitely need to go through both. They need to do a reduction in calories and increase their physical activity status to burn more calories off. So most people who are overweight, or obese, I should say, have to do both. They have to reduce their caloric intake, but they also have to increase their caloric expenditure. People who are maybe just overweight, a lot of times can modify just their caloric expenditure and move their body more on a daily basis and still see weight loss without having to necessarily decrease their caloric intake. Okay. But for diet goes, many folks talk about low-calorie diets. And a low-calorie diet for women is 1,000 to 1,200 calories a day. For men, it's 1,200 to 16 calories a day. Those are considered low-calorie diets. Now, that's pretty low. And in certain cases, it might be feasible, but in most, it's really hard for people to stay with a caloric intake that low unless they're completely sedentary, right? We want to make sure we're consuming enough calories to maintain homeostasis and to counter or offset the calories that we're burning in a day. We know that 1 pound of fat equals 3,500 calories, right? And heart healthy diets are what's recommended for these overweight and obese individuals. So definitely decreasing their saturated fat intake, no more than 10% of the total calories, decreasing their cholesterol intake through foods, no more than 300. Heart healthy diets will say no more than 200, and emphasize more of those complex carbohydrates. So the high fiber, right, whole grain types of carbohydrates. So as far as weight loss goes for these overweight, obese individuals, a realistic goal is 10% weight loss in a 6-month period. So that might equal 1 to 2% weight loss in a month or 1 to 2 pounds in a week. That's the general recommendations for people. So most clients with those metabolic conditions are going to be overweight or obese. So weight loss should be a major goal of any exercise and nutrition plan for these overweight and obese clients. But when we're working with this clientele, there are some precautions and things that as a personal trainer we want to think about. Number one is heat intolerance. These clients have an extra layer of insulation, all right? So they're more prone to, overheating. They get hot very easily. So we want to make sure that we have them in a setting where there's a lot of fans available, or we're exercising at cooler, points in the day, so they're not exercising in that heat. But that's one, heat intolerance. So that cooling mechanism, they have a problem with that. Number two is restricted mobility, right? We have extra body fat in the way, so it's harder for them to do, say, they're doing a standing quadricep stretch. They can't grab their foot to pull their heel up to their bottom end because there's extra fat in the way there. So there's restricted mobility. So how can we help that client do that stretch? Well, maybe it's giving them a towel and having them put a towel around their foot and pull it up so they have that extra distance there and it's easier for them to do so. Another one is just poor posture. They have bad balance. Those are concerns. Altered breathing, dyspnea. They have difficulty breathing, right? It's harder for them to catch their breath. So we have to be cautious with the types of exercises that we're giving them so they're not so winded. And then extra weight bearing. They're already bearing a lot of weight when they're standing, so we have to be concerned with, maybe they need to do non-weight bearing exercise just to give them a break from all that weight bearing stuff. So now let's talk just a little bit about diabetes. Okay, diabetes, you have two different types, type 1, type 2. So type 1 diabetes is an autoimmune disorder. Okay, and what's happening is the pancreas stops producing insulin. So the beta cells on the pancreas that produce insulin are destroyed. Usually it occurs early on in life. A lot of people are diagnosed at a younger age of type 1 diabetes. So they're dependent on insulin. They have to take those daily injections of insulin to maintain their blood sugar levels. Type 2 diabetes is the one that's more common. So about 90% of all cases are considered type 2 diabetic. And this is where their body becomes resistant to the insulin. So the pancreas still produces insulin, but their body becomes resistant to it. And therefore, over time, the pancreas has to work harder and produce more insulin to unlock those gates and allow glucose to flow out of the cells. So people with type 2 diabetes tend to be overweight, they tend to be inactive, and they have a higher risk of cardiovascular disease. What are some chronic results of diabetes? Well, over time, organ damage can definitely occur. So we see retinopathy, they have damage to eyes, so blindness can even occur. We see nephropathy, damaging to the kidneys. Neuropathy, they have damage to the nerves, and they have a hard time, say, it's important for diabetics to check their feet often because a lot of times they might have a wound on the bottom of their foot, not even know it, and over time that can become pretty cumbersome. So it's important that they check their feet often because of the nerve damage and they can't feel stuff like that. And then atherosclerosis occurs in the heart. So a lot of times we have plaque buildup in the arteries and also in the heart. So long-term consequences of diabetes are pretty big. So as far as exercise prescription, people who are diabetic definitely should have a medical evaluation before beginning. So if I was going to train a client who's diabetic, I would say please contact your physician, get a release from your physician prior to exercising with me. A big concern of people who have diabetes is hypoglycemia, so having low blood sugar levels. So just note that if you have a type 1 or even a type 2 diabetic, they should not exercise if their glucose levels are below 100. Okay? If it's below 100, they need to eat a carbohydrate-rich snack to get their blood sugar levels back up. But just know type 1, type 2 diabetics should not exercise if it's below 100. Hypoglycemia is 65 or less milligrams per deciliter. Okay, but that's a big concern of people who are diabetic and who want to exercise. So other factors to think about with diabetics, number one is increased exercise intensity. We want to try to, obviously beginners, we want to start off as a novice, but we can also increase their intensity over time. We want to progress. Longer exercise time. So maybe it's, doing a low to moderate intensity exercise, like walking, but instead of walking for 30 minutes, walking for an hour, right? So longer durations, because many of our, especially type 2 diabetics, are going to be overweight. So weight loss is key in that disorder. Inadequate caloric intake prior to exercise. So a lot of times they might come in with hypoglycemia, right? They don't have enough energy in their body to exercise, and therefore they're at a risk for low blood sugar levels. So make sure they have adequate calorie intake prior to each exercise session. Excessive insulin dose, insulin injection into exercise muscle. They don't want to make sure that they do that insulin dose right into the muscle right before exercise. And then obviously cold weather or cold environments are things to think about as well. So sometimes they don't do well in that colder environment. So as far as when we should not exercise, type 1 diabetics, no exercise if their glucose is over 300 or if it's over 250 with urinary ketones. A type 2 diabetic can exercise if the glucose levels are above 300, but without urinary ketones. Okay, so and diabetics are going to be checking their blood sugar levels, so they should know, but no exercise for type 1s if it's over 300 or it's below 100. Okay, no exercise for type 2 if it's below 100. They can exercise if the glucose levels are above 300, but without urinary ketones. Okay, so what are some signs and symptoms of low blood sugar? All of these. Okay, blurred vision is a big one, sweating, extreme hunger, they might have a headache, they might feel dizzy, might be anxious. Those are all signs that somebody has low blood sugar. So immediate treatment is with carbohydrate, 15 grams of carbohydrate. So a great thing for a personal trainer to have on hand, because even people who do not have diabetes can suffer low blood sugar levels. So having sugar packets, where you can just dump that sugar packet right into their water bottle, or having juice in your, just in your bag with you, where they can just take a drink of some orange juice or apple juice or something like that, where the carbohydrate is readily absorbed into the bloodstream. Okay. High cholesterol, hyperlipidemia is another issue people who have with metabolic concerns. So that's having high blood lipids, so high levels of fats floating in their blood. So dyslipidemia is having abnormal blood lipids. Okay. So people who have abnormal blood lipids have a strong relationship with coronary artery disease. So what should their serum cholesterol levels be? And I would encourage your clients to get their cholesterol levels checked at least once a year. So what should it be? Total serum should be less than 200. HDL should be at least greater than 40, and LDLs less than 100. Okay. Now, it's unrealistic to memorize, what's a moderate risk, a high risk, as those numbers change. Just remember, what should they be? So total serum cholesterol less than 200, right? Memorizing those, what they should be. But many people are on cholesterol lowering medication, and those are called statins, and they help to keep their cholesterol levels in check. But definitely encouraging your clients to exercise regularly, because that's going to help lower their cholesterol levels. And then lastly, you have metabolic syndrome. Metabolic syndrome is having 3 or more of these metabolic abnormalities. And I think of it as if a person is diagnosed with metabolic syndrome, they're on a fast track to developing cardiovascular disease, maybe some form of cancer, maybe diabetes. Okay, I think of that metabolic syndrome as a fast track to developing a more serious disorder. So again, to be diagnosed with metabolic syndrome, or they call it Syndrome X, you have to have at least 3 out of these 5 metabolic abnormalities. So the first metabolic abnormality is having a high waist circumference. So for males, it's over 40. For females, it's over 35. High triglycerides, anything over 150 milligrams per deciliter. Having a low HDL. So below 40 for males and below 50 for females. Having high blood pressure, at least above 130 over 85, and having an elevated FPG, fasting plasma glucose, of greater than 110. So if you have any 3 or more out of these 5 metabolic abnormalities, that person would be diagnosed as having metabolic syndrome, which, like I said, is a fast track to developing some pretty serious chronic diseases. So here are the general exercise recommendations for all of these metabolic disorders together. So like I said at the beginning of my presentation, it's unrealistic to memorize it for each one, but if you see some similarities between all of them, that's what you want to try to memorize. Okay, so for all of your metabolic conditions, diabetes, hyperlipidemia, metabolic disorder, and overweight or obese. So the general guidelines for aerobic exercise is at least 5 or more days a week. Okay, so we need to be doing cardio for this group. A lot. So 30 to 60 minutes per exercise bout. We want to maximize their caloric expenditure and burn as many calories as we can because these individuals are generally going to be overweight to obese. Begin with long duration exercise at a lower intensity and progress to short duration exercise, if you can, over a period of time using high intensity exercise because that's going to maximize your caloric burn. Resistance training, we want to try to do 2 to 3 days a week of this, 1 to 3 sets of at least 8 to 15 repetitions. Gradually progress that. You can progress those repetitions and choose body weight exercises. Okay, and then flexibility at least 2 days a week. And remember, mobility limitations with some of these clients. So we have to find ways, including foam rollers and different things where they can work on their flexibility because of those mobility issues. So those are our general recommendations. Also in that chapter, it does talk a little bit about anorexia, bulimia, female athlete triad. So I'd like you to read through page 507 and 508 for signs and symptoms of these 2 eating disorders, but also that female athlete triad. Look at the 3 things that compose the female athlete triad too. So when we meet again, I'm going to ask you to, figure out these answers to these questions under Show What You Know. There are just the 2. So the first one is a multiple choice question. The second one is another multiple choice question. The third one we normally would do in the classroom, but I'm going to have you do homework in relationship to that. So that is it for chapter 19.